Breastfeeding, like all good adventures, will have many experiences to learn from. Friends and family will share sensible advice, but sometimes it's hard to tell fact from fiction. One of the biggest myths is that of the good baby. Many people, including health professionals, will ask if the baby is good at night or if the baby is being good. For many people, a good baby means that the baby is sleeping for long periods and is not demanding. But in reality, a good baby should be waking often for feeds and wanting to spend time cuddled in their mother's arms. In the first 6 to 8 weeks, newborn babies will feed 8 to 12 times in 24 hours. Their stomachs are small and the milk digests quickly. For the baby, everything is new, exciting, and even a bit scary. The safest place to be is in the warm, loving arms of their parents. The newborn baby does not understand that the parents are still there when they are out of sight. This will take many more months to develop. Babies know that they are safe if they are close to the sounds that they have grown used to, such as the sound of the mother's heartbeat and breathing, and even the rumbling sounds of her stomach. Their world is complete in the environment of the mother's body and breastfeeding. Newborn babies cannot even control their own hands, let alone their parents. Their behaviours are not trying to wrap anyone around their finger, but they are trying to stay safe and secure in response to this bright, loud, cold and weird new place. It is important to remember that every baby is different, so try not to compare. Rather, respond to the baby's individual needs and take naps when the baby sleeps if you're tired. Another breastfeeding myth is that nipples need to be tough for breastfeeding. Before having a baby, mothers may hear many horror stories about breastfeeding. There are stories of cracked, bleeding nipples and many other painful problems. Nipples don't get tougher with breastfeeding, but mother and baby learn together about what hurts and what does not. Both mother and baby get better at breastfeeding with practice. It is quite normal to have tender nipples in the first few weeks of breastfeeding. Attach, breathe, relax, and count 20 to 30 seconds. If it's still hurting, remove the baby. Getting a baby to let go can be tricky sometimes. Place the finger in the corner of the baby's mouth and pull down to break the seal and remove the baby. When a baby is well attached, it will feel like strong sucking or pulling sensations, not pinching or biting. The nipple should look longer and rounder when the baby comes off, not pinched or squashed. Bleeding, damaged nipples is not normal. The baby should attach without ongoing pain. A mother who has damaged, painful nipples requires help. Contact a midwife, nurse or lactation consultant for professional help. There are 24-hour phone services available to provide help as well. The numbers are located on the back of the Blue Book. Another mystery and myth that we hear is that the baby has already been fed. Don't overfeed that baby, they'll get fat. The sounds of this story will repeat as often as the baby will want to feed. Newborn babies feed a lot. Think how often adults eat or drink. We have a drink of water, then a cup of tea and a biscuit, we suck on a lolly, eat a sandwich, or have a 3-course dinner and then feel like some chocolate. Babies are the same. How they feed changes throughout the day. Breastfeeding provides drinks, snacks, main meals and treats. It also provides a healthy serve of love, comfort and security. Some feeds will be quick. Baby may be thirsty and just needs a drink. Some feeds seem to go on forever. The baby takes one breast, then the other. Then the baby might go back to the first breast. And then when all seems settled, they have the other one again. Remember that piece of chocolate. These kinds of feeds are often called cluster feeds. Cluster feeding is very normal, particularly in the evening and at night. Sometimes babies appear to be sucking for comfort. Someone trying to be helpful will very likely point this out. Comfort sucking is normal. Dummies replace some of this type of comfort babies need. Babies are not using you like a dummy, but are using a dummy like a breast. If comfort sucking is meeting both mother and baby's need for love and contact, there is no reason to take the baby off. Breastfeeding is not only for feeding, but also for comfort. Likewise, if the mother's needs include having to go to the bathroom, then it's okay to take the baby off. Breastfed babies cannot overfeed. Some will be big and cuddly and will soon trim down when they start to move around and become active. Lactation cookies and magic milk fairies. The mother's hormones make breast milk. The rapid change from pregnancy hormones to breastfeeding ones happens immediately after birth. Feeding the baby in the first hour and lots of skin to skin helps these hormones along. Between days 3 and 5, the breast will become full and heavy with milk. Lots and lots of sucking by the baby in the first few days brings in the milk. For most mothers, keeping up milk supply for the baby all comes down to letting the baby feed when they need to. This is sometimes called demand feeding. When the baby removes milk from your breast, your body will replace it. If the baby takes out less, like replacing a breastfeed with a bottle or dummy, your body will make less for next time. Remove more milk by extra pumping or extra sucking by the baby, and the body will ramp up production. Eating foods that nourish your body is important when breastfeeding, but there is very little evidence for special lactation foods that make extra milk. While some foods may be helpful, the best way to make more milk is to remove it. Talk to a midwife, nurse or lactation consultant if you think you are not making enough milk for your baby. If someone makes you a meal or makes biscuits with special milk boosting powers, eat and enjoy. But keep removing milk from the breasts or pumping, as this is the best mother magic around. The best recipe for making milk is 3 kilos of on-demand feeding, 2 kilos of skin to skin, 2 cups of determination, 1 cup of breastfeeding support to taste, and mix well. Foremilk, hind milk, fatty milk, and milk that isn't good enough. It may be confusing to hear all these things about when and how you should feed your baby. Remember, if babies are hungry, feed them. Milk is milk. Yes, it is true that fat content increases as a baby empties the breast, but it's important to let the baby soften and lighten the first side before offering the second side, but not worrying about whether it is fatty or not. Remember the good baby story? A good baby will tell you they are hungry often. A good baby will want to have both sides sometimes and one side sometimes. Babies will drain the breast sometimes, and other times they will just have a small drink. So try to remember to start each feed on the opposite breast. The foods mothers eat may change the taste and smell a little for the baby. Babies won't mind little changes in the menu, and most tastes won't make any difference to them. If the baby is extra windy after a certain food, stop eating that one for a while and try another time. Enjoy the foods you normally eat. The baby has been enjoying the taste for a few months now in the amniotic fluid. Sometimes you'll eat healthy foods, sometimes not. Baby won't mind. Milk is milk. Breast milk will not always look the same. Sometimes it's yellow, like colostrum milk in the first week. If the mother or baby have been unwell, milk changes to keep your baby safe and well. Sometimes milk may look greenish or pinkish or bluish, depending on what you've been eating. Established breastfeeding makes milk almost look like skimmed milk. Trust that your body knows how to make milk for the perfect recipe for your baby. Milk is milk.